Now, after a heart attack, you are started on a lot of medication, but in order to get the most out of your care, we need to ensure that we are optimizing treatment and making sure that the patient is involved and they understand what is going on in this situation. So that's why in this video, I'm going to go through what each medication is used for, how to optimize treatment, and how to best understand your condition after having a heart attack. But one thing I need to make clear is that even though this looks like a medication review, because I am a prescribing pharmacist, I need to make sure that this is not medical advice. It is for informational purposes only, and you should seek the advice of your clinician if you want to adopt or adapt any of your treatments going forward. Now, it's best to start off with what is a heart attack. So you might have heard the fancy term myocardial infarction, and that basically means death of the heart muscle. And this is because a heart attack is usually caused due to a lack of blood flow, which means a reduction in oxygen to the heart muscle. And as a result, the heart muscle dies, which then leads to the heart not being able to be as efficient as it was beforehand, which is why we then go through numerous treatments such as stents, revascularization, and in the large majority of the cases, starting patients on a lot of medication to ensure that we are improving the heart health and making sure that this doesn't happen going forward. Now that you understand the fact that a heart attack is due to a reduction in blood flow to the heart and the fact that now it is damaged, we need to preserve as much function as we can. This can then help you understand why you are starting on a lot of these medications going forward. So there is a set protocol, and this is going to be quite a generic overview, but we're going to start with blood thinners, also known as antiplatelets. Now, normally after a heart attack, you are started on two. One of them normally is aspirin, which I've got here, and the other one could be one of the following. It could be clopidogrel, prasugrel, or ticagrelor. And the reason you're starting on two is because after a heart attack, we need to make sure that your heart's getting enough blood, because there has been potentially a clot beforehand. And within the first 12 months, you are then at a higher risk of having a further heart attack, which is why you are normally put on two blood thinners. However, one thing to note is at the 12-month mark, a lot of people are then stopped on their second blood thinner, and they then are normally carried on aspirin alone. So if you've had a heart attack and you've been 12 months since that event, you should always request a review, because you should be looking at whether you need to be on two blood thinners or one just going forward. Now, things to look out for: the dose doesn't really need to change with antiplatelets, but you need to keep an eye on stuff such as unexplained bruising and bleeding, because that's how the medication's working. It is stopping your platelets, which normally make your blood sticky, from activating. So if you experience trauma, then you are more likely to feel the effects of prolonged bleeding, and this is why we need to make sure that this is not happening overtly within the body. Moving on from antiplatelets, one medication that is usually prescribed to prevent you from having any stomach bleeds is one called lansoprazole or ramipril. These are a class of medications called proton pump inhibitors. A lot of people are aware of these because they are normally within the news and media. Now, these work by reducing the amount of stomach acid that the body produces, and by doing so, it reduces the chance of irritation on the stomach, which would normally cause a gastric ulcer or a stomach bleed. And when you are then tying that with blood thinners and you've got an ulcer or you have a stomach bleed, this is going to be potentiating that whole effect. So whilst you're on two blood thinners, the majority of people will be prescribed one of these to protect their stomach going forward. However, when that second blood thinner, like I said, normally stops at 12 months, a lot of patients will then have no need to be on this going forward unless you are in a higher risk category. And these are people over the age of 70, have a history of gastric ulcers or gastric bleeds, or they are on other medication that can increase the risk of bleeding. And this is always a conversation to bring up with the prescriber. But common things to look out for with regards to proton pump inhibitors are the fact that it can lower your magnesium and B12, it can increase the risk of osteoporosis, and it can also increase the risk of stomach infections. So ideally, if you are on this long term, make sure you are getting it reviewed on an annual basis. Now I'm going to move on to probably the most controversial medication on the planet, which are statins. And after a heart attack, you are normally started on a high dose statin. And the reason being is that most heart attacks are due to a buildup of plaque, which is then ruptured to then cause a lack of blood flow within the heart. So statins are there to prevent you from having further plaque buildups going forward. And they work by reducing the amount of cholesterol that your body produces and also removes it from your circulating blood. Now, as with all medication, there are known side effects with this. The most common being muscle aches and muscle pains. And this is something that you should always get looked at, because in a lot of the cases, it is just a temporary mild reaction. However, it can be something called rhabdomyolysis, which is a severe breakdown of muscle, and we need to make sure that this is not happening, because it can bring a lot of complications with it. Now, with regards to monitoring with statins, you would have had your blood tests taken within the hospital, but at the 3-month mark, you should be getting your liver and cholesterol profile checked again and again at 12 months. And this is just to ensure that your liver is metabolizing the drug as effectively as it should be, and also that your cholesterol profile is going in the direction that we want it to go, which is normally lower than what it was before, because then this gives us, based on all the evidence, a reduced chance of having a further heart attack. Common things to also look out for with statins is to not have it with any grapefruit juice. And if you are on a lot of antibiotics, some of them can interfere with this, so you should always speak to your clinician when they are prescribing certain medications. We'll now move on to beta blockers, so in this case bisoprolol, and these work by reducing your heart rate. And this seems a bit counterproductive, because if you've just had a heart attack and your heart's not going to be pumping as effectively as it was before, why would we want to reduce the rate at which your heart's beating? And it sort of confuses a lot of people. But if you think about it, if your heart's being damaged, we need to make sure that every heartbeat counts. So by slowing the heart rate, it gives the heart greater time to fill up and then contract more blood, and then it gives each beat more purpose. Now, a lot of people will continue on these long term. However, in some people at the 12-month mark, you can have a review to see whether you have any heart failure as a result of your heart attack, which I'll come on to explain in a minute. And if you don't really have signs of heart failure with regards to your scan results, then you can potentially have this removed. But that is, again, something that you will discuss with your clinician. The biggest thing to look out for with beta blockers and bisoprolol is that because it lowers your heart rate, it can cause something called bradycardia, which is excessively low heart rates. And if your heart rate goes too low, as too will your blood pressure, and then the organs of your body will not be getting enough blood flow. So ways that we will check this is by doing a heart rate, a pulse reading, and blood pressure as frequently as possible. Now, after a heart attack, that is usually within the 1 to 2 weeks for a good 3 months, because we are trying to optimize your medication at that point. But going forward, if you feel signs of shortness of breath, if you feel as though your extremities, so hands and feet, are colder than normal, or you just feel a bit more lethargic, then that is something you should always seek and just have another review to make sure that this isn't reducing your heart rate too low. And one thing I want to say is that if you look at athletes, they will have inherently low heart rates, but that's because they built up their strength in the heart so that each beat is able to supply the body with enough blood and oxygen. However, when we are putting you on beta blockers, we are medically inducing a low heart rate. So your heart is not as strong as an athlete. Therefore, if your heart rate goes below 55-50, then that is potentially not supplying your body with enough nutrients. That's when you start getting symptoms such as being tired, lethargic, and it's something that we need to address, because we need to make sure your blood pressure is high enough along with your heart rate. To finish the main block of medication that you are prescribed after a heart attack, you are probably going to be started on ramipril, which is a class of medication known as ACE inhibitors. Now, what these do are normally by lowering your blood pressure, but also allows the heart to again beat effectively, but in a different way. So it relaxes the veins going back to the heart and the arteries coming away from the heart. By doing so, it reduces the pressure at which the heart needs to press against. By doing so, it gives the heart a bit more time to beat. It reduces the stress on the heart, which is all beneficial. And you can sort of see the link between all these medications is to reduce the effect and pressures on the heart after a heart attack and make sure that it is as efficient as possible. Now, as always, there are things that we need to monitor with this medication. After every dose change, you should be getting your blood pressure, heart rate, and your kidneys checked within 1 to 2 weeks, and then on an annual basis, because these medications are classed as protective of your kidney. However, if you are sick, dehydrated, it can cause kidney damage or a mild kidney injury. So it's something that you should always be looking into. Other common side effects are a dry cough, which is non-productive and is easy fixed by swapping this out to a similar medication in a different class, which gives you the same effect. And they can cause high potassium, which is why we get your kidneys checked at least on an annual basis. Now, the medication I've just went through are the core medication minus the proton pump inhibitor maybe for when you have experienced a heart attack. But like I said before, I mentioned the word heart failure, and what heart failure means, it actually sounds a lot scarier than what it is. So after you've had a heart attack, you've deprived the muscle of the heart of any oxygen and blood, which has then caused the death of some of the muscle cells. After that point, your heart may not have the ability to meet the demands of your body, and that is what is classed as heart failure. So if I wanted to go for a jog and I felt out of breath, then there's a good chance that my heart is not being able to meet the demands of my body at that moment in time due to the fact that I've had a heart attack, and that would be classed as heart failure. Which is why we then start some patients on some extra medications. And the first one is called spironolactone. And this works by reducing fluid accumulation within the body. Because fluid accumulation, when you've got a heart that's inefficient, will lead to more problems. And you may have heard of terms such as fluid on the chest, and that will then lead to a reduction in oxygen that's being exchanged through the lungs and leads to more complications down the line. So as with all the rest of the medication, we need to monitor this at least every 6 months by doing your kidneys, blood pressure and heart rate. But also if you have a dose change, same as with ramipril and similar medication, is that you have to have your kidneys checked with bloods at least 1 to 2 weeks after the dose change. And the last medication I'm going to discuss is one called dapagliflozin, which a lot of people obviously struggle to pronounce, but it did start off life as an anti-diabetic drug. And the reason being is that it basically causes us to weigh out excess sugar within our urine, which then leads to the same net effect which spironolactone does, and that is reducing fluid accumulation within the body, which you've probably gathered is beneficial at this point because less fluid within the body leads to less pressure on the heart when it comes to circulating that blood volume. And obviously, like with all the rest of the medication, they all come with side effects. With this one, it will be increased risk of urinary tract infections and thrush around the private region. Now that is something that you just need to be aware of. When it comes to monitoring, again, it's not as strict as the others, but you will be getting your bloods in terms of liver, full blood count and kidneys checked at least on a 6-monthly basis because you've got this medication. So all the monitoring will be covered when you are looking with regards to this medication. Obviously, medication only forms one part of your treatment after a heart attack, and cardiac rehab normally has a very, very high success rate, but it just wasn't the purpose of this video. So if you have just had a heart attack, make sure that you are engaging with the cardiac team because they will be providing cardiac rehab, which usually has at least a 25% reduction in further events just by doing that alone, and they will give you all the advice and information that you need. Again, I have to make this clear, this was for informational purposes only and does not constitute the practice of medicine. If you are in any doubt about your medication and medical treatment, you should always seek advice from your clinician. If you've got this far, thanks for watching and I will see you in the next video.